Welcome, everybody, to Home Heart Health. I am the Nurse Ninja, and today we're going to be going over uh, Next Generation NCLEX style questions. There's been an update as of, I think it was April 2023, in the NCLEX, which is the National Council Licensure Examination for registered nurses, and there's one for LPNs as well. And that was changed to reflect the complexity of care that our patients are starting to require in the hospital, and actually have been requiring for quite a long time, and to prepare nurses better to recognize complex situations and diminish the number of failure to rescue cases in the hospital with new graduate nurses. So I'm going to dive into what next generation NCLEX style questions look like and just kind of give you an overview of what they are, why they are, what some of them look like in this presentation. So let me share my screen with you. All right, there we go. So this is part of a test taking success series that I'll be doing. This will be a standalone video, but there'll be a series on some test taking strategies coming up shortly, and I do hope you tune in to check those out. But this is going to be on preparing nursing students for course exams, NCLEX, and beyond. So those changes that I mentioned regarding the NCLEX, they're going to be reflected in your nursing program. So if you have not yet started a nursing program, these are the kinds of questions they're going to build you up to. If you're in the middle of a nursing program, these are likely some of the different formats for test questions that you're starting to see on exams. I have taught Med-Surg 2, Pharmacology 2, Critical Care Nursing, Med-Surg 3, a couple other courses in kind of the middle and the end, the culminating semester of nursing programs in the college setting. And as our students move along the pathway of a nursing program, we introduce every semester more of these style of questions to them so that we build up that cognitive capacity, that stretch of your brain a little bit more with each semester until you get to the NCLEX, and then you've seen these kinds of questions before. They're not a huge shock for you. So that is what I'm hoping this will do here, is expose you to some of these and what they look like. And again, if you've seen these before, if you haven't seen these before, if you haven't started a nursing program and there's a bunch of the terminology and stuff I'm saying that you don't understand yet, don't worry. This is just to give you a sneak peek look at what these kind of odd looking questions look like. So the first time you see them, it's not overwhelming. Okay, our objectives for this presentation is we're going to review NCLEX exam goals, explore the effective strategies to help improve student performance on course exams, discuss NCLEX test-taking strategies to help students succeed on course exams and to prepare them for the NCLEX. The end goal is to develop practice-ready nurses. That's right, the end goal of this is not to help you pass the NCLEX. The end goal of this is to make practice-ready, safe nurses who can see a situation developing and intervene before it becomes a crisis. Understanding test anxiety is important. Everybody has test anxiety to one degree or another. It's common. It has real implications. And there's a bunch of mindset tips. I'm going to do a separate video on some of the ways to handle test anxiety, some meditation exercises to kind of help you woosah, bring yourself out of that sympathetic state back into a parasympathetic state where the higher functions of our brain work. Because the more we spin our wheels in that anxiety we've all experienced, the harder it is to come up with answers, even to things we know the answers to. But briefly, some mindset tips are that we need to promote a growth mindset. So all of my training that I offer through Home Heart Health is all about a growth mindset, reframing thinking. We're looking at progress, not perfection. We want to focus on preparation. The more prepared you are for something, the more naturally confident you will be at it. You put more work on the front end of it, then when you actually hit the test, you actually hit the skill you need to practice, it goes smooth because you've prepared so much on the front end that the back end then really becomes almost a nice coast down. The more prepared you are, the more you can actually enjoy the test taking process. And believe it or not, you can actually enjoy a test. We're going to discuss relaxation techniques. Again, I'll do a whole separate video on these, demonstrating deep breathing exercises, visualization exercises, and how to manage stress before the test and if it should rear its head during the test. All right, NCLEX, Next Generation style questions. The NCLEX Next Generation is designed to better address nursing candidates for their clinical judgment, decision making, and their ability to apply knowledge to complex real world scenarios. This new version of the exam includes innovative items that are types that are better reflective of clinical decision making processes and the nurse's use of that knowledge in practice. So again, these questions are actually really kind of cool. They're designed to really reflect what it's like to really be a nurse and how do I apply that book learning in a real life scenario. Next Generation NCLEX or NGN, again, officially launched on April 1st, 2023. It was issued by the National Council State Board of Nursing, or NCSBN, which handles all things NCLEX and license related. And again, the reason why was nurses are caring for patients who are far more complex. They have complex comorbidities. We're getting really good at keeping people alive with heart failure, for example. But that means we end up with people who have heart failure, who have longer lives, better quality of life, but they live long enough now that that starts to affect their kidneys. And now you have a complex patient who has heart failure and kidney failure. We have, unfortunately, an increasingly unhealthy diet in our society, which is also adding to the complexity of our patients. So we're ending up with a lot more patients who have aggravating, complexing issues like type 2 diabetes, which is going to complicate all of their health concerns as they age. This requires higher levels of clinical decision making in the nurse and an innate ability to prioritize nursing care. And you'll notice that the vast majority of NCLEX style questions are prioritization of care questions. You have to do a lot of things as a nurse. Which one do you have to do first? Which one is most important? Which one is going to cause the biggest problem for this patient if it doesn't get done? We prioritize that secondhand as nurses, but it's a learned skill. So these questions I think are really great because they really are designed to help you learn how to prioritize. All right, failure to rescue, I touched on earlier. New graduate nurses. No one expects a new grad nurse to know everything. You do not have to know everything to pass the NCLEX. You do not have to know everything to be a new grad nurse. The NCLEX is designed to ensure that only ready to practice safe nurses get their license and are able to practice. But being a new graduate nurse means you're new. You lack experience. So that lack of experience, that lack of, hey, I haven't taken care of 50 patients with heart failure, for example. I've only seen this once. So I don't necessarily have this wealth of personal experience that I can bring to the table to know, ooh, if this happens, I bet this is going to happen. So new grad nurses come with a lack of personal experience, which is just a reality of being new to anything. They enter a workforce where the workload is incredibly heavy. even in hospitals that are considered good hospitals with more appropriate workloads, the workload for nursing is incredibly heavy. I've met lots of people that think they want to go into nursing because it's a good paycheck and it's a worthwhile field and they can make a lot of money doing it. And I tell them there are lots of jobs where you can make more money and work way less than you do as a nurse. Nursing is a heavy workload, even in a good facility. Inadequate support and mentorship programs. A lot of hospital systems have tried to correct this. There is a lot of effort, but there is definitely a big gap in the support and mentorship needed. Nursing tends to be more and more a younger nurse's game. Um, we need more experienced nurses, but with the heavy workloads and burnout, post COVID in particular, there's a loss of that experienced mentorship from more senior nurses that really understand and have the experience to help those new grad nurses, and they've moved on to other positions due to those extenuating circumstances and the workload and all of that. And then the workplace culture. There is a terrible uh, turn of phrase that I wish were not true, and I think it has become less true in the last 10 years plus that I've been a nurse, but it still exists, and that's nurses eat their own. It's terrible, but it's true. There are nurses who will just emotionally destroy another nurse on a unit because they don't want the new grads there. New grads, they're afraid will get people hurt. They're afraid that there will be some kind of negative result of having all these new grad nurses there, or it's a threat to their their leadership on the unit, or a million different reasons. We've all worked in hostile workplaces, and fortunately, because this has been something that we've worked so hard in nursing to eliminate and change, I really have seen a big change in this. But workplace culture, we want a workplace culture that promotes new graduate nurse excellence, that helps them excel, that gives them that mentorship to help them be successful on the unit, so that we build stronger units that are better places to work for everybody. All right, types of questions that you're going to see on the NCLEX. Again, this presentation, this is not about, I'm going to show you a bunch of NCLEX questions and all their answers. These are sample concept questions. So you start to see the kinds of questions that you're going to see on NCLEX. There's the foundational items that have been around for a long time, multiple choice and SATA, or select all that apply questions, fill in the blanks, hotspots and drag and drops. Those have been in the NCLEX for a while now. The new items that we're starting to see are standalone items like bow tie or trend questions. And I'll show you a bow tie question at the end of this presentation. Multiple response items, grouping, select all that apply, have continued to be big. And drag and drop downs, highlighting multimedia where they show you like a picture of a chart and they want you to navigate with a mouse to click a part on the chart that shows the important information you would need to take care of this patient at a critical moment of care. Sounds and videos. Sound, listening to heart sounds, listening to lung sounds as part of the test question. Maybe they play you the sound of crackles in the lungs and ask you what medication might be ordered for that patient who has congestive heart failure, and you hear this sound in their lungs, and they want you to identify, oh, they would need a diuretic to help pull fluid from their lungs, because that sound that they played is the sound of fluid overload in the lungs. So those are all new and they're really cool. It's easy to get scared by these questions, but they're actually really cool questions. As both a nurse and a teacher, I like what they're doing with NCLEX. And if you can get to the point where you can embrace it and not be afraid of it, I think you will too. The key focus is always on patient safety and assessing the candidate nurse's clinical judgment. Okay, this is an example of a highlight question. Again, I'm not going to give you the answers to this, but this is an example of the way you might see a question listed on the NCLEX. Now, highlighting questions will have specifically highlighted text or a highlighted table that they'll ask you to choose from. It's a plus or minus scoring. Credit is given based on the number of the correct responses minus the number of the incorrect responses. And again, we see this at the academic level as well. The total score cannot be negative. However, a negative score would be rounded to 0. So let's look at this question. All right, so you should be able to see my cursor, my mouse here. You're going to see a screen like this, and it'll have a little tab here to say, for example, client history, and it will have a little bit of information here, a little blurb. This slide is not clickable, but there would also be a toggle clickable tab here for the nurse's notes, which I'll show you on the next slide, or vital signs. And the tester can click on either of those areas and toggle back and forth between different bits of information like we do in a real patient's chart. And then it'll have the question over here to the side, highlight the information which is most important for the nurse to consider when providing care to this client. So when you read a question, always look at the stem to identify, are you looking for a true-false question? A true statement in this question, like, should the nurse do? Consider when would be indicating that we're looking for a true answer to this question, because they have false answer questions as well, where it might say something like, the nurse should reconsider if something happens. The nurse knows that further education is needed if, and then we know that whatever answer we look for in the answers, we're looking for the wrong thing, the thing that's wrong that we want to correct. And we'll go into that more when we go into our test taking strategies video series. So with this, I know that I'm looking for a positive true statement because the nurse should consider when providing care to this patient. So the nurse should consider or to consider. So I'm looking for a positive, a correct thing here. And I know it's a prioritization question because it has the word most in it. Most important for the nurse to consider. I'm looking for a true statement. And when I see the word most, and I know it's a prioritization of care question, I know that I should expect to see many answers, multiple answers as my options that are correct. And I want to find the thing that is most correct. Okay, so let's read through our client history here and then just take, and I'll toggle back and forth between nurses' notes and vital signs just so you see what those screens look like and what this example question would look like. They're much more interactive and more drawn out than a multiple select answer. All right, so client history. 84-year-old client diagnosed with stage 4 lung cancer with metastases to the brain and liver. The client lives with his daughter and her family, who are his main caregivers at home. The client's advance directive states that he does not want CPR, intravenous fluids, antibiotics, a feeding tube, or hospitalization at the end of life. His daughter is his healthcare power of attorney. Looking over to the right, we are to highlight the information which is most important for the nurse to consider when providing care for this client. Advance directive, that is how my patient has legally declared that they want to be cared for. That's going to dictate everything else I do. Confusion, that'll come into our nurse's notes here in a minute. Agitation, not sleeping. Some vital signs are in here, some abnormal temperatures, a low blood pressure. The patient appears potentially to be on some oxygen. Breath sounds is an option. A productive cough, pain, sips of water, refusing food. So there's a bunch of different vital signs and conditions listed off here to the right for me to choose and highlight. So if I advance to the next slide here, this would be as if I toggled on that nurse's notes. And again, this will all be an interactive question for you. The nurse's note, I dive into the chart more and I learn that the client is sitting in a recliner. They're awake, they're confused, and they insist that he needs to go see his wife, who has passed on and is deceased 15 years ago. The daughter states she's very concerned because the client has become more agitated over the past 2 days and is not sleeping at night. The client's skin is hot and pale. The oral mucous membrane is dry. Breath sounds are diminished throughout with coarse rhonchi on the right side. Patient has a productive cough with large amounts of thick white sputum. The client reports terrible pain in his back that's not being relieved by his current pain medication. Patient is taking sips of water, but's refusing food and reports having no appetite. So we've clicked on nursing notes and the story has unfolded more for us. Now we have more information. Now some of our options to choose from here start to tie in and make more sense. What are my most concerning options there? You know, is it more concerning to me that the patient is taking sips of water or that the patient has a fever and a low blood pressure? And then if I click on vital signs in that example question, then the computer will show me an example of patient vital signs. And in this case, the patient's vital signs, the blood pressure or BP is 108/60. It's a little low. The heart rate's 88, which is a normal speed, but it's irregular. So it's an irregular rhythm. The temperature, patient has a bit of a fever, 100.8 Fahrenheit or 38.22 Celsius. Their respiratory rate is 18 breaths per minute. And their SpO2, that's your pulse oximetry reading or the amount of oxygen being carried in your blood. And that's 92% on 2 liters nasal cannula. So the patient's on a little oxygen support. And 92 is our bare minimum for our goal for our patient's oxygen level. So they're at goal, but they're requiring some oxygenation support to help them maintain that level of oxygen in their blood. Okay, so now we're starting to get more of a picture of our patient. Now, again, depending on where you're at in your preparation, whether you're beginning nursing school, in nursing school, or studying for the NCLEX, you may have some level of idea as to what some of our priority things are that we would have to consider here in providing care to this client. So that's just an example of taking a question on the NCLEX and expanding it out. So this is the style of question that you're going to see when you get to the NCLEX. All right, so again, this is not about like, here's all the answers. This is about introducing you to the kinds of questions. So we're going to move on to another kind of question here. This is an example of a drop-down question. So again, we see a similar setup. We have the client's history, nurse's notes, and vital signs. So the same thing, this would be a clickable question. I could navigate between nurse's notes and vital signs to answer my question. In this case, it's the it's an 84-year-old client diagnosed with stage 4 lung cancer with metastasis to the brain and liver. The client lives with his daughter and her family, who are his main caregivers at home. The client's advanced directive states that he does not want CPR, intravenous fluids, antibiotics, feeding tube, or hospitalization at the end of life. Daughter is his healthcare power of attorney. And then we have 2 drop-down questions. And the first one is the nurse completes the client assessment and immediately blank. And we would be able to click the little arrow here and it would drop down a menu of different interventions that we would immediately do based on our client's assessment. And we would click on one of those and informs the caregiver that, and then we would drop this one down and we would select the thing we would have to tell the daughter about the intervention that we chose. So this is an example of a drop-down question. Again, this is considered one question with 2 parts, and it would be fully clickable, navigationable. All right, so here we go. Same thing. We've got our client history, nurse's notes, and vital signs. Same patient, same situation. And this is just an example of a different way they might matrix the question. So this is a matrix multiple choice question. And you see at the end of the visit, the nurse reevaluates the client. The indicates we want to indicate if the assessment findings are improved, if they show no change, or show the client has declined. And different information would be now added to the nurse's notes and added to the vital signs, because now they're asking us for an assessment as to whether or not things have gotten better, stayed the same, or gotten worse. And you can click in between these. So it would give us more information about the patient's respiratory status, their respiratory rate, and it's changed, their oral membranes in their mouth, their temperature. It'll tell us what we see now, and we're supposed to identify if they're better, worse, or no change, because that is something they want nurses to pay attention to trend and to intervene, because it's not reality of nursing isn't the patient's fine and then they're like on death's door. There's a lot of things that happen between fine and dying most of the time. Sometimes you get a massive pulmonary embolism or a massive heart attack. Yes, people can die very suddenly, but usually there's a bunch of indicators, and they want nurses to be able to identify those indicators of improvement or decline early on. So again, we can rescue the patient and avoid that failure to rescue as a new grad nurse. So this is a really cool question for that, asking us to start to notice and identify trends. So how this is graded, a matrix multiple choice. Within each row, you will choose one response. You can also have matrix multiple choice responses. It's a 0 to 1 scoring. You will not get any points taken off if you choose the wrong answer, only scored points for the right answer. All right, so that's an example of an next generation NCLEX style question. And then here is our final example. Again, we're not going over all of this. It's just kind of an introduction as to what they look like, how they work. So again, you're not intimidated when you start to see them. This is a bow tie question. This is actually kind of cool. So a bow tie question is going to ask us to complete the diagram by selecting from the choices below to specify which potential condition the client is most likely experiencing, and 2 actions the nurse takes to address that condition, as well as 2 parameters the nurse monitors to assess the client's progress. Again, the nursing process that we all follow, our algorithm, before AI thought the algorithm was cool and stole it from us, our nursing algorithms were if this, then that. And with this, if we assess, we need to then plan an appropriate intervention. And then just like that last question, determine whether the patient got better, worse, or stayed the same. So we're reassessing. So the nursing process is we assess, we intervene, and then we reassess to see if what we did worked. And if not, we have to change our plan of attack, our course of action. So this question would give us a patient scenario similar to what we've seen in the last couple of questions. And we are to then identify what we think is going on with the patient. Do we think this patient is suffering from atrial fibrillation based on the description of the patient, an abdominal aortic aneurysm, ventricular tachycardia, or pneumonia? So based on the patient's presentation, well, if we use our metastatic cancer patient, they had an irregular heartbeat, an irregular pulse. Maybe they had atrial fibrillation. I could choose atrial fibrillation. If I chose atrial fibrillation as my potential condition, then I would want to list what I should monitor for. If they're in atrial fibrillation, maybe they've had some kind of cardiac event, or their heart's getting ischemic from poor cardiac output. And maybe I would want to monitor troponin levels. I would ask my provider to order troponin levels on my patient. Or I would definitely want to monitor their heart rate, because it's an abnormal rhythm that can start to go very, very fast. If they were in atrial fibrillation and they were, because that's not the same thing as CPR, doing a defibrillation or an immediate cardioversion on a patient is different. that could fix the atrial fibrillation, and it would still be within their end of life parameters. So I might consider preparing the client for an immediate cardioversion to electrically convert them out of atrial fibrillation. Performing a cardiac stress test, no, but I would want to get a 12-lead EKG to make sure that I knew what rhythm my patient was in. And you could do the same for any of these. If you thought that the patients that they described had pneumonia, you would put in maybe chest X-ray neurological status, maybe a 12-lead EKG, and incentive spirometry use. So that's how a bow tie question works. And you would drag and drop. Let's say I would grab atrial fibrillation, put it up here, grab my troponin levels, put that here, put my heart rate there. And then on the left side, I would prepare for client for immediate cardioversion. I drag that up here, get a 12-lead EKG, take that right there. So that's a kind of a drag and drop, and they call it a bow tie question because it's kind of the shape of a bow tie. And we're pairing the diagnosis of the patient, their potential condition, with what we need to assess and monitor and what we need to do. So we're looking for identification of the pathological process or the problem that's going on here, the assessment we need to do on it, and the intervention that we would do based on that assessment. All right, so that's a bow tie question. Examples of bow tie questions, a typical client judgment question is given, including a clinical scenario, either presented as a paragraph or nurse's notes. It has a total of 5 answers. You will not get any points taken off if you choose the wrong answer. You get partial credit if you get part of the answer correct. And the student will start in the middle, starting with that blue box, dragging one potential condition from the blue area to the middle, 2 actions to take on the left for the green, and 2 parameters to monitor on the orange on the right side. And it's a 0-1 scoring, earning 1 point for each correct response, but no points are deducted for any incorrect response. The total score is the sum of the correct responses. So there you go. That is a little introduction into our Next Generation NCLEX style questions. If you got any questions yourself on the NCLEX or other NCLEX style questions, things you've heard, things you've not heard about the NCLEX and how to prepare for it, if you've taken it and you have some best tips for other people watching this video, please go ahead and put those in the chat below. And if you've got anything you'd like to see videos on in the future, again, please put those down. I'll read through the notes and be happy to get some more things up for you. So again, I hope this was helpful to everybody, and I will see you in our test taking strategy series. And in the meantime, happy studying.